Pharmaceuticals. A pharmaceutical is defined as a medicinal substance that alters the normal processes or functions of an organism, or more simply, a medical drug. Recently, powerful pharmaceuticals have been developed to combat sickness and disease. These medicines have the power to alleviate pain, promote general health, and even cure disease in many cases. But pharmaceuticals can be both beneficial and harmful because of this power. Pharmaceuticals are not just medicines that heal, they actually alter the way an organism functions. As a result, care must be taken with these medicines. Understanding the history of pharmaceuticals and the ways in which they work is crucial. Pharmacology, the chemical study of medicines and their uses, first appeared in the early 1800s. Prior to this, treatments for disease were often given without any comprehensive understanding of their effects on the body. Oswald Schmiedberg, the founder of modern pharmacology, looked at how chloroform, a chemical that causes unconsciousness when inhaled, interacted with cells in the bloodstream, which began the movement to recognize how substances affect the body. There are three main ways in which pharmaceuticals work to fight sickness. The first is by attacking and killing foreign organisms in the body, such as those that cause infection. In many cases, the pharmaceutical alters the way in which the invading organism functions, leaving the host organism unaffected. Antibiotics, for example, stop the disease from functioning at all. However, in some instances, the medicine may work by disrupting the activities of diseased cells, as in the case with antifungals. The second way medicines work is by either increasing a reaction or preventing a response to the disease, which eliminates many of the symptoms that can cause the sufferer problems or discomfort. Anticoagulants do this by preventing the normal clotting of blood in a person who has a clotting disorder. If a cell is not functioning properly due to a disease, the pharmaceutical may increase the activity or responses of the cell, as in the case of people with Parkinson's disease. Another way that pharmaceuticals get rid of disease is by supplementing substances within the body. Often when a cell in the body is not functioning properly, it is because it lacks something essential to carry out the function, and a pharmaceutical simply replaces the missing substance. This is why, for example, diabetics get insulin injections. Healthcare professionals often look at the ways pharmaceuticals interact with the body when determining their usefulness and what their benefits are. The first thing that many doctors and other medical practitioners look at is the way in which medicine is taken into the body for use. Typically, a pharmaceutical reaches the bloodstream through absorption into the skin, through the mouth, or through the lining of the intestine. Another important aspect that should be looked at is its distribution, or the way in which it progresses and moves through the body. Medical professionals also have to consider how the body processes or metabolizes the substance. If it is broken down into something toxic, it usually isn't suitable for medicinal use. The fourth important criterion for usefulness of pharmaceuticals is the way the drug is excreted. Typically, this occurs through the bile, the breath, or the skin. In the medical field, these considerations are abbreviated ADME: absorption, distribution, metabolism, excretion. Pharmacologists look very closely at a drug's ADME when determining how to best utilize its medicinal benefits. Drawbacks to pharmaceuticals are that some have serious risks. Side effects of drugs can include nausea, vomiting, heart damage, liver damage, and a host of other problems. The use of some drugs carries the added risk of dependency. In fact, more recently, abuse of prescription drugs has become a widespread problem. For this reason, most countries strictly limit distribution of prescription medicine. Before a drug can be prescribed, it follows a set protocol and goes through rigorous preliminary screening processes, clinical trials, and other tests. It is then only legally distributed by licensed medical professionals. Pharmaceutical companies are working diligently to discover medicines that can cure or alleviate the diseases that are the most fatal or most greatly affect a person's quality of life. Long-term effective treatments for diseases such as AIDS, cancer, diabetes, stroke, heart disease, and Parkinson's disease remain undiscovered, however.